and welcome to Migraine Health News. My name is Bertrand Doeuk from the Brisbane Headache and Migraine Clinic, and today we have a very special guest with us. We have Meg Richards on board with us. Thank you very much for joining us today.
Thank you for inviting me.
Now, Meg has over 30 years of experience, and she deals a lot with treating sufferers with neurological and vestibular disorders. And Meg now devotes her time solely on doing vestibular rehabilitation. So it's a very pleasure to have her on board with us, to talk with us. So the topic of discussion today is all about vestibular disorders. So Meg, can we first start off with you explain to us a bit more about all the different types or the main types of vestibular disorders and what they are?
Mm-hmm. Okay, yeah. So probably the two most common conditions that we see in our clinic at the moment are benign paroxysmal positional vertigo, or BPPV, and also vestibular migraine. So they're the two most common. We do see quite a few other conditions, for example vestibular neuritis, or commonly known as labyrinthitis, which is post-virus in the inner ear. We see people with Meniere's disease, often late stage, who are in what we call the burnout phase, so that they're experiencing symptoms in between their episodes. We also see people pre and post surgery for different vestibular conditions. For example, people who've grown a benign tumour on their hearing and balance nerve, and that's known as an acoustic neuroma. We also see people who have vestibular symptoms without a diagnosis, and also people who are elderly and have the effects of age on their vestibular systems, and hoping to help them with preventing falls.
Great.
In terms of what they actually are, the two most common ones, BPPV, it's a condition of the inner ear where some little crystals or ear rocks break off, and they come out of the main part of the inner ear and they float into some little canals called semicircular canals. When they're in the canal, they act like a foreign body. They're not supposed to be there. Normally it's just fluid in the canals. And so when you move in the plane of the canals, certain movements, like quite commonly looking up, looking down, bending, rolling over in bed, those sorts of things, you'll get the crystals moving and sending an abnormal signal from that canal to the brain and up to the eye muscles. And so you'll get eye movement, involuntary eye movement, which is called nystagmus, and you'll feel, people will report the world spinning around. It happens while those crystals are in the canal, and if it's not treated, then the crystals might end up floating out of the canal by themselves, but that takes some time and it can be pretty inconvenient or pretty stressful for the person having their condition. And so I'll talk about treatment later on for that, but the other common one is the vestibular migraine, and it's basically just a migraine condition, but it affects the vestibular centre in the brain rather than giving people a severe headache. It gives people vestibular symptoms.
Okay. And can a vestibular migraine sufferer suffer from vestibular conditions with migraines or without migraines as well?
Yeah, so a vestibular sufferer can have classic migraines with the headache, and they can also have the vestibular migraines, or they can be prone to one type at a certain time in their life, and they can be prone to the vestibular migraine later on in life. So commonly I see women who have classic migraines pre-menopause, then they have a break where they don't have any migraines at all, and then they develop vestibular migraine after menopause.
Yeah. And Meg, I often get a lot of vestibular migraine sufferers as well, whereby they may say that they suffer from vertigo. But after assessing more and talking more about their symptoms, they actually in fact don't suffer from vertigo, and in fact suffer from other types of vestibular symptoms. Meg, are you able to let us know a bit more about the different types of vestibular symptoms?
Yeah. So there are three primary symptoms that people get when they have vestibular disorders. That's vertigo, dizziness and balance problems. There are a lot of associated problems or secondary problems like sweating, nausea, vomiting, increased heart rate, visual distortions, hearing changes, but just to name a few. But the main ones are vertigo, dizziness and balance problems. And vertigo itself is quite a misused term, even by medical professionals, and it actually means when those little crystals send the abnormal signal to the brain and up to the eye muscles, and you get your involuntary eye movement, which is nystagmus. It's what you see or what you feel when your eyes are moving in that way that's vertigo, and people usually describe it as the world spinning around. It's not actually a fear of heights. It's not actually wooziness in the head. It's not being unsteady on your feet. It's actually when the world's spinning, and it needs to be accompanied by the eye movement. So that's basically what vertigo is. Dizziness is a much broader term, and it basically could be heaviness or lightheadedness, but it's all a sensation in the head, or being off balance in the head, being woozy in the head. And balance problems is basically just being physically unsteady on your feet, maybe having to take a step or put your hand out to steady yourself, veering when you're walking, that sort of thing. Yeah.
Great. And Meg, out of those three primary vestibular symptoms, would one be worse than another? For example, is vertigo more disabling than having dizziness?
Vertigo itself can be very frightening, and particularly the first time people have it, so it's pretty scary, and it can be quite severe. People can be very disorientated. They can they can fall over, they can collapse. It's quite a severe symptom. But dizziness and balance problems are also very disabling. So it just depends on the severity of the symptoms and whether it's prolonged, how much it's impacting on people's quality of life and their ability to function.
And you also mentioned that vertigo sufferers will experience involuntary eye movements. So when a vertigo sufferer has this, are they aware that their eyes do involuntarily move, and also do their vision become a bit distorted because the eye moves?
Yeah, a lot of people report to me that they can feel their eyes moving, and sometimes they'll say that's the primary thing they feel rather than the world spinning. But most people just say the world's spinning, and when you ask them if they can feel their eyes are moving, they can't always feel it. Sometimes their partner who looks at them can say that they see the eye movement during an attack, but it's not always, they're not always aware of it.
Okay. And you also said before that vertigo sufferers have a very specific description whereby the world is spinning. And when that happens, do they often find that they're sort of bracing themselves, or they try to hold onto a rail or furniture? And even though if they're holding to a rail or furniture, can they sometimes just fall over as well?
It can be very disorientating, and sometimes the symptoms are quite violent. So at times people have fallen, particularly if they bend forward to pick something up and they get it. It can be quite violent and make you collapse or overbalance. It does, certain forms of vertigo often happen in bed, so you don't fall, but sometimes people feel like they might be going to be thrown off the bed or tipped off the bed. It doesn't involve any loss of consciousness. That would be a different type of problem, but it certainly can make people collapse and feel very frightened.
And is there a particular time or length of time of how long a vertigo attack may last for?
So that depends on what the cause of the vertigo is. So as I said, the vertigo is a symptom of different conditions, and it presents differently depending on the condition. So certainly if someone has BPPV, they would experience vertigo in short bursts. It's what they call transient, so it lasts less than 30 seconds. But in certain conditions like vestibular migraine or vestibular neuritis, where the vertigo can be prolonged and it can last for minutes or hours or days. So it's very variable, and it just depends on what is causing the vertigo.
Okay. So to clarify, it seems as if with vertigo, vestibular disorders, there's three primary types of symptoms. One being the vertigo. So vertigo is more of an external sensation whereby the world is spinning, whereas dizziness is more of an internal sensation whereby they feel the brain, or the head is like, for example, lightheadedness or heavy-headedness and wooziness. And whereas imbalance is more of a physical imbalance issue whereby they may topple over, or they may rock to the left and the right side. And so when a vestibular sufferer have these conditions, can they have all these three in one go?
Yeah, certain conditions can have vertigo, dizziness and balance problems. Quite commonly with vestibular migraine, it can include all of those symptoms. If someone has vestibular neuritis in the acute phase, they'll have vertigo and they'll be pretty unsteady or mightn't even be able to stand up. But then later on, and when they come to the subacute or the chronic phase, they might have more dizziness and not vertigo. So you can have a combination depending on the condition.
Okay. Fantastic. So now that we've spoken a bit more about the symptoms, can we discuss more a bit about the causes? And maybe we can clarify more the causes of, for example, BPPV and vestibular migraines?
Yeah, so BPPV, unfortunately, the cause of BPPV is not really known. So in a small percentage of cases, people would get the condition because they bump their head or have a whiplash or have a virus in the inner ear. So a very small percentage of people, that will lead to the little crystals loosening so they can break off. But in the large majority of cases, the cause is unknown. So we say to people not to avoid certain activities or not to stop doing things because they think it's going to lead to having an attack of BPPV, because that just impinges on your lifestyle and doesn't allow you to enjoy doing the things you like. But basically, we don't really know what the cause is for BPPV, but we do know now how to manage it very well, and so we can prevent it from impacting as much on people's lifestyles by getting rid of it as soon as it occurs. So with vestibular migraine, we have some idea about some of the causes, but we don't know all of them. Basically, people, it's something that runs in the family. So if you have a history of normal migraines, or if you have a family history of migraines, you'll be more prone to getting that. And also people who suffer from motion sickness as a child, they can be prone to getting migraines later on. It's also certain times of life. It can be hormones, it can be a combination of certain things in your life like stress or not sleeping well, not eating regularly. Those sort of things can be triggers to giving people vestibular migraine. In terms of the vestibular neuritis, which is the virus, it's not a cold or flu virus, so they don't have to have been sick before it starts, but basically it's a similar family to the cold sore virus. It's just dormant and it occurs, we think, possibly sometimes when people are run down and overtired, it can occur, but really we don't understand the mechanisms of that either. But it's basically not given to someone through air or touch. It's just triggered internally.
Yeah, it's interesting to note. It seems like a lot of these vestibular disorders, there's no hard literature to show what the exact cause is. But it's fantastic to know that there is help available and that you are able to help those with BPPV and vestibular migraines and all those other types of vestibular disorders as well. It's also interesting to note that Meg and I, we have been working together quite closely for quite some time now, and whereby we're able to help both together with those with vestibular migraine sufferers. Here at the Brisbane Headache and Migraine Clinic, we do see a lot of those with migraine, headaches, trigeminal neuralgia, and also vestibular migraines as well. And one common thing that we do find is that the people with migraines or vestibular migraines, they also have a very hypersensitive or an overactive brainstem. Now, the brainstem houses a lot of cranial nerves, and when those nerves become hypersensitive, that's what can also reproduce pain. They can shoot up and over into the head, whether it be in the eye, the top of the head, the back of the head, but it can also cause a lot of other symptoms as well. Nausea, vomiting, being sensitive to the light, sound or smell, aura symptoms, dizziness as well, but a lot of vestibular conditions as well. But it's good to see that we're able to, although we do some completely different from one another, it's good that when we do find that we've combined both services together, that we're able to give vestibular migraine sufferers a great help with their life and a significant change as well. Meg, could you let us know who would be a suitable candidate to come to see you to receive treatment from you?
Yeah, so anyone who has any of those three primary symptoms or combination of them, so the vertigo, dizziness or balance problems, regardless of whether they've been diagnosed with any particular condition. Sometimes it's not possible to give it a name, but people who have any of those symptoms, we could certainly, through our assessment, determine whether it is a vestibular problem and whether we're able to help. You don't have to have a referral to come to a physio. If you've been to specialists or had investigations and those results are available, then that's helpful, but it's not essential.
Fantastic. And could you let our viewers know what to expect? Like if someone wants to come to see you, what would they expect in their first consultation? And also, how does vestibular rehabilitation work?
So yeah, at the initial consultation, which is an hour, we take quite a long time getting the details or the history of the symptoms, because it's the pattern of the symptoms and that helps us determine what the problem is. Then after we've determined that, we spend a bit of time doing clinical tests. So we look at eye and head movements, we look at balance tests, we look at walking tests, we time them, we basically get people to do different things that challenge the vestibular system and see how they respond. And that's our baseline to see if we can change those things with the future treatment. We also have some video goggles, which is has an infrared camera clipped into the goggles, and we can see people's eyes on our laptop, and we can see when they're experiencing their symptoms what their eyes are doing, and that tells us what the problem is and where it is, and enables us to direct our treatment. So from that assessment we base our treatment, and if it's BPPV, that's a different sort of treatment. It's we basically use a series of head positions and gravity to float the crystals out of the canal where they're causing the problem. We're not sure what happens to them once they're out of the canal, but we assume that they filter off somewhere, and once they're out of the canal all the symptoms stop. It usually only takes one treatment, occasionally two, and then after that, if it recurs, people can have the choice of coming back to have the treatment in the clinic if they don't want to do it themselves, or they can be given written instructions and manage it themselves at home. So that's BPPV, and that's separate to the other types of problems. With the other types of vestibular conditions, there's two main approaches. One is to challenge the vestibular system in a series of exercises over a period of time, so that the vestibular system balances you better in standing and walking and enables you to do the things you want to do. The second type of approach is desensitising the system to certain stimuli in the environment, or certain stimuli in everyday activities, so that you don't get dizzy or off balance when you do everyday sort of activities. So we can use both of those in combination, or we can use one or the other to improve people's function and quality of life.
It's fantastic, especially with BPPV, that you can help a sufferer within 1 or 2 sessions.
Yeah.
So a significant change, because I understand that BPPV can be extremely disabling. So when they get to see you in 1 or 2 sessions time, they're significantly better. That's quite an amazing feat.
Yeah, and sometimes people have a combination of conditions too. So commonly they might have BPPV and vestibular migraine together, and one feeds off the other, and sometimes if you can sort one out, then the other one settles down fairly quickly as well.
Great. Could you let our viewers know where they can find you? Because I believe that you've got quite a lot of clinics around Brisbane and Queensland.
Yeah, our main clinic's in Moorooka in Brisbane, and we do all our bookings through that, but we travel to Cleveland and Nunda, and also Scarborough on the peninsula, and Maleny up in the Sunshine Coast hinterland.
Fantastic. Well, Meg, thank you very much for joining us today. It was a pleasure having you on board, and that gives our viewers a lot of information about vestibular disorders. So thank you very much for joining us. My name is Bertrand from the Brisbane Headache and Migraine Clinic. We also have Meg Richards from Equilibrium Rehab. There's information about how to contact us below here if you do have any further questions. Once again, this has been Migraine Health News, and we look forward to seeing you in the next episode. Thank you.
Thank you.